often would I need to get a colonoscopy?
So the recommendation is for everyone to have a colonoscopy starting at the age of 50, once every 10 years. For African Americans, the recommendation is to start at the age of 45, because the incidence of colon cancer is a little bit higher in that population. A lot of physicians, however, think that 10 years may be a little too long to wait, because if we don't see a polyp or miss a polyp, which is another risk of this procedure, is potentially there's a little bit degree of human error, and we may miss a flat polyp or a polyp that may not be easily visible. And to wait 10 years to come back and see that polyp again may be a little too long, because sometimes these precancerous polyps may turn into cancer in less amount of time than 10 years. Sometimes it may take 7 years for them to turn into cancer. So in general, a lot of physicians are recommending colonoscopies every 5 years. Now, if someone has a history of colon polyps, or polyps are found during a colonoscopy, especially if they're precancerous, then we definitely want to bring someone back in 5 years. Sometimes less, depending on the nature and the number of polyps. Sometimes we may bring them back in 3 years or even earlier, depending on how aggressive the polyp that was found was, how many polyps there were, in what locations there were. So these are all variables that we'll have to discuss after your procedure is finished, after we get any pathology reports back, if we encounter polyps, so we can decide together when would be a good time interval for you. Patients who have had a family history of colon cancer need to do it earlier, need to do it every 3 to 5 years, even if they themselves don't have polyps.